We are now in one of the worst flu seasons in 2 decades, and we still haven't reached the peak. Unity Point Health is seeing a surge in cases as patients head to the emergency room. Here's a look at some of the numbers seen in ERs here in Des Moines. For the week of December 14th, 4 adults and 29 kids tested positive for the flu. That following week, it was 34 adults and 131 children. 1 week later, we're talking 45 adults, 115 kids, all testing positive for influenza. Here to talk about that surge is Dr. Josh Raymond, Chief Medical Officer at Unity Point Clinic. Thanks so much for joining us.
Yes, hello.
What a fun topic. I told you we've been covering this story kind of all week because this year's sticking out from others when it comes to flu season.
Yeah, we've seen a big surge in the last 3 weeks, and nationally there's, they're calling it the super flu, but it's really just a different variant that the flu shot didn't fully cover. And then we just have a little bit lower vaccination rates nationwide, and so we are seeing high numbers compared to previous years.
And it's such a difficult time of year. You know, we just got done with the holidays, so everyone's together. It's cold, people are inside, so they're just spreading those germs, and it's made ERs extremely busy for Unity Point. Primary care is same with urgent care. Let's talk about, what people are seeing or feeling and when they need to decide, okay, I'm going to the emergency room or I'm going to go see my primary care doctor.
Yeah, I think the biggest thing is making sure that people are getting to the right place of care, so we're not overwhelming our ERs, and that's what we're seeing right now. So if you're having chest pain, if you're having severe shortness of breath, obviously the ER is the place to go. But if you're having those mild symptoms, I would recommend calling your PCP office. We're trying to keep more same-day appointments open so people can get in. We're increasing hours for our urgent care and express locations. Some we're starting as early as 6 in the morning. We're trying to keep them open until as late as 10 at night when possible. You can find that on our website, which locations those are. And then if you have very mild symptoms, obviously you can stay at home, take over-the-counter medications, get plenty of rest, fluids, and you don't need to necessarily go seek medical care if it's very mild symptoms.
Yeah, mild, a lot of times it is just kind of waiting it out, as fun as that isn't to do. Now, we know that we're seeing an uptick in the number of cases, but what about severity of these cases? Do you think that this is also something that you're seeing rise?
Yeah, I mean, we are seeing more patients hospitalized, and that's why our hospitals are very full. And so, the flu shot, even though it doesn't cover all the variants, 100% this year, it is still doing a very good job at keeping people out of the hospital and keeping people from needing to seek that urgent, emergent medical care, especially in kids. It's about 75% effective at keeping them out of the hospital and keeping them out of the clinics and the urgent cares. And
usually we don't see the peak of flu, sorry, bad news, till like February. So if you haven't gotten your shot, it's still worth doing.
Yes, if you have not, call your PCP office. Contact a pharmacy near you. It takes 7 to 14 days to be at its peak effectiveness, and then it'll last for multiple months. And so you can get it before we see the peak here in 6 weeks or so.
Because we always talk about flu season, but the flu is year round.
Yes.
You can always get the flu. It doesn't matter whether it's in season or not.
Yes.
So it is important to have that.
Yes.
Now, we were talking a little bit before this interview off camera. You were saying some elective surgeries had to just be rescheduled. It's probably just wanting to keep people out of hospitals and in those kind of situations. Can you talk a little bit about what you guys are seeing on that front?
Yeah, it's never an easy decision, but our hospitals are so busy right now that when those patients come in with their severe illnesses, we need to make sure that there's beds available. And so we are, for about a week or so, pausing elective cases that require a hospital stay afterwards. So the important thing to realize is that 80% of our surgeries are still happening, but for a short time, we want to make sure that when those patients hit the ER and need a bed, that we have a bed open so they can get to the floor and get the care that they need.
And then a lot of times when we're talking about the flu, it's reminding people of the basic things. We had this a lot with COVID. If you're sneezing, cover your mouth, wash your hands. If you're not feeling well, stay home to keep this from spreading.
Yes, it's the holiday season. We kind of wrapped it up, but people are still having those events. It's okay to skip it if you're not feeling well. If you do have to go out, wash your hands, cover your mouth when you sneeze, cover your mouth when you're coughing, all that common sense stuff. And I think the biggest thing is if you can stay home when you're not feeling well, stay home.
Okay, absolutely. Yeah, great reminders. And then real quick, we're seeing a big number in children as well. Back to school was this week. So any recommendations for parents there? Again, if you're not feeling well, have your kid home.
Yeah, I think that's the biggest thing. Yeah, okay. I mean, the flu shot, we know it helps more in kids than adults. And then, yes, if they're not feeling well, try to keep them home so we're not spreading it through the schools post-holiday.
All right, Dr. Raymond, 'tis the season,
Yes.
flu season. Thanks so much for joining us
Yes.
and kind of workshopping all of that.
Thanks for having me.